Hydrogen sulfide, it is a colorless, transparent gas with a smell of rotten eggs. It dissolves in water and burns in air with a pale blue flame. Hydrogen sulfide is referred to as a knockdown gas because inhalation of high concentration 700 to 1000 ppm can cause immediate loss of consciousness and death. Natural sources: natural caves, volcanoes, decaying fish, sewage, severe gas, manure, and putrefying cadaver. Industrial: petroleum maintaining industry, silk, rayon, and paper manufacturing process. Action: hydrogen sulfide does not combine with the hemoglobin, but does with the methemoglobin to form sulfur methemoglobin. It causes asphyxiation by interfering with the use of oxygen in the cytochrome oxidase system. Its toxicity and rapidity of action is comparable to hydrocyanic acid HCl. Signs and symptoms: significant hydrogen sulfide poisoning refers occasioned by inhalation. As a cellular poison, hydrogen sulfide affects all organs, particularly CNS and respiratory system. CNS: headache, vertigo, nystagmus, weakness, convulsion, coma. Respiratory system: rhinitis, dyspnea, cyanosis, crackles, apnea, pulmonary edema, severe chest pain, bradycardia, arrhythmia, and myocardial depression. Ocular lacrimation, photophobia, conjunctivitis, gas eye, metabolic acidosis also. Presence of hydrogen sulfide apparent because of the characteristic rotten egg smell. However, concentration more than 150 ppm may overwhelm the olfactory nerve so that victim may have no warning of exposure. Fatal dose and fatal period: more than 200 anosmia, pulmonary edema; more than 500 hyperapnea, apnea, rapid unconsciousness, knockdown to or immediate collapse; more than 1000 respiratory paralysis, death. Exposure of more than 700 to 800 ppm can cause immediate cardiopulmonary arrest. Detection of hydrogen sulfide: if significant present in significant concentration, can be detected by exposing a filter paper moistened with lead acetate. The filter paper will turn black. Spectroscopic test: is characterized by absorption spectrum of two bands consisting of one band in the red between C and D and a fainter band between C, D and E. Differential diagnosis: smoke inhalation, carbon monoxide, cyanide, and hydrocarbon. Treatment: high flow 100% oxygen is the main therapy of hydrogen sulfide poisoning. Remove the victim into fresh air, artificial respiration, and 100% oxygen is given. Antidote: amyl nitrate and sodium nitrate without thiosulfate enhance the formation of methemoglobin, which in turn is spontaneously detoxified in the body. Break 0.3 ml ampule pearl of amyl nitrate in a gauze and hold over the patient nose for 15 to 30 seconds. 0.3 mg of sodium nitrate in 100 ml of sterile water is given slowly. Slow IV for 2-3 minutes. Supportive measures: correction of electrolyte imbalance, metabolic acidosis, and pulmonary edema. Postmortem findings: signs of asphyxia, cyanosis, frothing at the mouth, nose, and petechial hemorrhage and respiratory mucosa are seen. Rotten egg odor is present around the nostrils and mouth. Greenish discoloration of viscera, grey matter of the brain, and bronchial secretions may be found. Pulmonary edema and congestion of viscera are seen. Brain, subcortical and white matter demyelination and globus pallidus degeneration. Medico-legal aspect: poisoning is always accidental, causing number of deaths in a severe workers. Petroleum industry is responsible for most cases of hydrogen sulfide toxicity in North America. Hydrogen sulfide has recently been implicated in suicide in Japan. Chemical or detergent use: suicide in Japan. It is a newer method of committing suicide and is gaining popularity in other countries from internet suicide website. A near instant death may occur by mixing common household chemicals with bath sulfur 5 to 30% calcium polysulfide with a toilet bowl cleaner, 15% HCl to create hydrogen sulfide gas in cars, closet, or other enclosed spaces. Chronic hydrogen sulfide exposure causes headache, nausea, weight loss, weakness, ataxia tremor. Patient can lose their ability to smell and detect the gas even though it is still present in environment, olfactory fatigue, and paralysis. Low level exposure of hydrogen sulfide affect the mucous membrane and may cause conjunctivitis, pharyngitis, green-gray lion, gingiva, and wheezing. Postmortem finding: asphyxia, cyanosis, frothing at the mouth, petechial hemorrhage, rotten egg odor, greenish discoloration of viscera, pulmonary edema, plain subcortical white matter demyelination, and globus pallidus degeneration. Thank you.